You're still dealing with acute infections, which sort of cause things to unravel for a short period of time. But on top of that, you're dealing with the things like diabetes, high blood pressure, risk of heart disease. If a GP is really good at his job and you're a good patient, you probably almost avoid having those conditions. It's very difficult if you're genetically predisposed, and then it's about minimising the effects of that genetic risk. Diabetes is one of those conditions that we have huge amounts of information about because so many people get it. So there's very good research about what you should be doing, and it's very well supported by the data available. So ideally you don't want your BMI to get above 25. You want to be doing some exercise regularly, and it doesn't have to be to the point where you get injured, but you should be doing 2 to 2.5 hours of some form of exercise every week. And on top of that, you've got to have a reasonably healthy diet. So if you take care of those three things and have a regular check to make sure that despite that you haven't developed diabetes, then you should be okay. Well, type 2 diabetes occurs when the metabolic load on your body, particularly your pancreas, is beyond the capacity of your pancreas to manage. There will be a point where your pancreas can't cope with the workload. Now, if your lifestyle is unhealthy, you're overweight, and you put extra demand on your pancreas, that point will occur earlier. Type 2 diabetes is a long-term chronic disease, and the longer you live with it, the more damage occurs to the blood vessels and the more risk you're at from developing a heart attack or a stroke or some other serious complication. So it's true it can be managed. Ideally it could be avoided, but if you do develop diabetes, the most important thing is to manage it really well. We do know the targets you need to hit to minimise the risk of progression of the disease, and you should know those targets. You should be measuring yourself against those targets, and you should be doing everything you can to hit those targets. We never used to think so, but there's good evidence now that if you get type 2 diabetes and it's caused by your lifestyle choices plus potentially being overweight and unfit, that if you reverse all of those processes, there are people whose results go back to normal. It's still unclear whether we should consider them diabetics in remission or whether we should think of them as non-diabetics. The tendency is to still try and manage them pretty carefully because we are worried it'll come back as they age or if their lifestyle deteriorates. Eat a really healthy diet. Eat a healthy diet. Avoid too much salt, starch and fatty foods. Try and get your weight to something healthy. You can easily work out what your maximum safe weight is. You try and get your BMI down to 25 or less. And do some exercise. It doesn't have to be something that puts you in danger of getting injured, and for patients that I have that find it difficult to exercise, I try to get them to build it into their routine. So if they catch the bus to work, I say get off the bus a kilometre from home and walk home. If they're always short of time in the morning, then I say, well, in the morning don't worry about doing that, but on the way home you get off 2 kilometres and walk home. That gives you your exercise, and it's not really that strenuous.